Hey. Chapter 21, Allergic Reactions and Anaphylaxis. I'm sorry for the late stream tonight. I've had a lot going on today with my primary job and a lot of grading and admin stuff for your class as well. So I apologize for the late hour of dropping this, but it is recorded, so you can watch it anytime. But I know some of you enjoy the Socratic method and want to ask questions. So the options there, but you can always, watch the recording later and jump on that. And you can always email any questions you got. Of course, flashcards are wonderful and such and such. So I'm gonna go ahead and share my screen and get this thing cooking with grease. So if anybody jumps in, we'll keep them and talk to them as we get through it. So allergies and allergic reactions and anaphylaxis. So let's talk about it. This is the study of immunology. So we need you to learn how to recognize and manage shock that is related to the difficulty breathing and the hemodynamic instability that can be caused by anaphylaxis. So we're going to learn about hypersensitivity disorders, allergies, allergens, and of course, anaphylactic reactions. So this is actually a pretty common call that we respond to as EMTs and paramedics. And the big thing is recognizing that it's actually happened and acting quickly upon that recognition. So when it gets to be an emergency, when it gets to be a real big problem, when there is acute airway obstruction and cardiovascular collapse. So without getting too deep into the patho, what actually happens, let's say a bee stings you or some type of allergen enters your body. Your body will just go crazy with a hypersensitive, oversensitized immune response. It'll release an antibody called IgE. And IgE will then attack the mast cells and the basophils and degranulate them. And as it's degranulating and tearing them up and pulling things off of them, one of the big things that it releases is histamine. Histamine will cause vasodilation and leaking out of the vascular bed. So it makes the veins, the pipes, blow up. It'll also bronchoconstrict, make the airway passages much more narrow and harder to breathe. And that fluid that leaks out of the pipes will leak into places it ain't supposed to be and call it, like the throat for one place is a very common area. The face can get swollen up, tissue can swell up. But when that fluid leaks into the throat, it causes the laryngeal edema, which means that the larynx, the tissue around it starts to swell and collapse that larynx. So also there are some other body symptom signs that are involved, and we're going to talk about those going on. Another thing that histamine does is cause increased gut motility. So the patient could be nauseous, could be vomiting, could be pooping everywhere, or wanting to poop everywhere, but they'll have a lot going on. All right, so let's move on. Being able to distinguish this body's unusual response and they're having an allergic reaction is a huge part of being an EMT, and being thorough is a way to catch that, doing a full head to toe and getting a full history on the patients. Now, a lot of times you're lucky enough to get there and you pull up and the patient's like, I'm allergic to peanuts. These losers put peanuts in my salad. Who puts peanuts in a salad? And now I feel like my throat's closing up and I'm allergic to them. That's a pretty obvious, like, here you go. But when it's more important to be even more thorough when it's not so obvious. So I had a lady I picked up one time that was allergic to grass, and she'd been outside playing with her son, and they were rolling on the grass, and she started having trouble breathing. Throat was closing up, and I got there, and she had hives on her, and the only reason I knew she didn't know what was going on. The only reason I figured it out is because the hives were very telling. I was like, ooh, you got bumps all over you. You got any allergies? I know of. And she's like, I feel like my throat's closing up. And I was like, I'm pretty sure you have an allergic reaction. So the immune system protects the body from foreign substances and organisms. When a foreign body enters the body initiates a series of responses to inactivate the invader, to inoculate it, to destroy it, beat its butt. So an allergic reaction, in a nutshell, write this down. An allergic reaction is an exaggerated immune response. I am going to test you over that exact saying. What is an allergic reaction? Answer: exaggerated immune response to any substance. Not caused directly by an outside stimulus, can be caused by the body's immune system. Your body freaks out with something that gets inside of it, and it's usually a foreign antigen. So your body releases chemicals to try and combat the stimulus, including histamines, leukotrienes, and a bunch of other chemicals. The main one we're talking about, histamine and its effects. The great thing is a lot of these patients will know they're having a reaction. So like I said, you show up and the patient saying, I'm allergic to peanuts, I put peanuts in my salad, that kind of thing. But even if they don't know what's going on, you need to be able to recognize the signs and symptoms and maintain a high index of suspicion. Now, not all allergic reactions are big, bad, life-threatening things. My now 4-year-old, when she was a 1-year-old, her face broke out one time. We found out she was allergic to strawberries. She has since, she's not allergic to them now, so it was just a passing thing, but her face just blotched up back then. Her body was still creating an immune system, I guess, and wasn't quite ready for the proteins and whatever other enzymes strawberry had in it. So it can be mild, it can be localized, it can be severe and systemic. Let's say a bee stings me on the finger. Ouch. Now, I'm not allergic to bees. I've been stung by a bee. What happens is I have a little localized reaction. I have a little bit of pain and swelling here, and nothing else happens. But if you're allergic to bees, you could have the whole finger swell up. It's an allergic reaction. Your finger swells up and it just feels uncomfortable. When it becomes anaphylaxis is when it involves more body systems, such as your skin, your circulatory system, your respiratory system, your cardiac. When those other systems start getting involved, because it's now spreading instead of localized, it's systemic, it's becoming a system problem, an entire system problem. That's when we have bigger issues. So anaphylaxis, though, is an extreme, life-threatening allergic reaction. It involves multiple organ systems. The difference in allergic reaction and anaphylaxis is allergic reaction, kind of focalized, localized. Anaphylaxis is involving multiple body systems and can rapidly result in shock. Shock meaning anaphylactic shock. Shock is hypoperfusion. Hypoperfusion is shock. This is one of those shocks we talked about in the chapter 13. When we talked about it, we talked about anaphylaxis causing widespread circulatory vasodilation, causing all the pipes to get so big that the pressure in the system falls and that the heart can no longer pump. Well, it's not the heart's problem, but the pipes are so big that the pressure in the system cannot reach the end organs for perfusion needs. So they need a certain amount of perfusion, blood flow, and oxygen, and they're not getting it. Patient will be in shock because they're hypoperfusing in their body system. So some of the things we're going to be looking for that'll happen. So let's say a little bee stings you. It releases those antigens or that bee venom into your body, right? Your body releases chemical mediators like the IgEs. All right, so it comes here to the mast cells and starts to degranulate. And once those histamines and other things are released here, it'll start to affect body systems. So for the skin will get a thing called Paritis, Urticaria, and Edema. So Paritis just means itching. Paritis just means itching, and Paritis just means itching. Urticaria is just a fancy word for hives. Now, why do we use these big, fancy, weird words? Well, nobody on the street's really saying that, I promise you. But again, registry's not going to say a patient's having difficulty breathing. They're going to be saying the patient has dyspnea. Registry's not going to say the patient's having itching skin and hives. They're going to say the patient's exhibiting Paritis and urticaria. So we have to know these terms. We have to know these terms. Edema. Edema, again, is when fluid is stuck in the tissues and it's not inside the vascular space like it's supposed to be. Now, moving over to the blood vessels right here, blood vessels will vasodilate. Remember, the pipes will get real big and they'll start to leak. Fluid and plasma will start to leak out of these bad boys and they'll go into spots that it ain't supposed to go to. That's where the edema comes from. Now, the heart will have decreased output and decreased coronary flow. Why? The pipes are too big. The pipes are too big. The pressure is not high enough to reach the targets, right? So they'll have decreased cardiac output and they'll have decreased coronary flow, which means the heart itself won't be getting enough oxygen. And then the lungs will have bronchospasm and vasoconstriction. So the lungs, their blood flow will be decreased and they'll have bronchospasm. So the pipes inside the lungs that are allowing air to come in and out, you want big pipes to breathe better. They'll narrow to the point where you can't breathe. You'll start to develop wheezing, big, bad, aggravating stuff. All right, so there's three super common signs of anaphylaxis. This is urticaria or hives. Look at here now. So the guy right here is starting to develop these little whatever's on his back, and they're big welt-looking things. They're very common when somebody's exposed to an allergen. It might be one of the most early warning signs. It's just raised area on the skin. So small areas of generalized itching or burning that may appear, and they're raised. These are raised bumps on the skin, usually a little bit red. All right, another sign, very common. I wouldn't call angioedema that common. So angioedema is this right here. This is that old cow tongue that happens a lot. Now this is very common with lisinopril. Lisinopril is a blood pressure medicine that's given to a lot of patients for chronic blood pressure management. And one of its side effects is to cause big cow tongue like that. That could become an airway reaction. So angioedema, I can call it a very common sign, but their face and their inner airway here can swell. So that is an issue. So that could become a airway obstruction very quickly. So we need to make sure that patient's able to ventilate and oxygenate normally. Now, wheezing is super common. Now that I'll agree with. Super common is the wheezing. So wheezing again is a high-pitched whistling breath on expiration. That is a lower airway sound. Wheezing is a lower airway sound. If you didn't catch it the first time, wheezing is a lower airway sound. Do not confuse wheezing with stridor. A patient with anaphylactic reaction going on can have stridor as well. Wheezing is a high-pitched whistling breath that is heard on expiration through auscultation with a stethoscope. And stridor, well, stridor is a high-pitched crowing or kind of whistling sound heard in the upper airway, but it's more of a crowing or croaking sound that the upper airway makes. And it's usually the sign of a partial airway obstruction. Now, if your larynx is swollen and it's starting to close upon that glottic opening, then that will be a partial airway obstruction. And you could actually hear stridor. Do not confuse wheezing and stridor. Stridor is upper airway, wheezing is lower. And there it is, stridor on inspiration due to upper airway narrowing. There you go. Hypotension is going to happen due to vasodilation and increased capillary permeability. So the capillaries will start to leak and fluids will start to go in places they're not supposed to. Hypotension, again, the blood pressure will drop because the pipes are bigger than hell. Nausea, vomiting, abdominal cramps, these are all very common with the histamine release and allergic reaction. So some allergens you want to be aware of. Food may take up to 30 minutes to appear. Why is that? Well, you can eat the food and your stomach lining protects you from a lot of that. But once it starts to hit that small intestine and it starts to be absorbed into the body, now that is when it starts to distribute throughout the tissues. That's when they'll start having allergic reactions. So it's not always a immediate thing. Shellfish and nuts are pretty common. Those people are probably aware of that by this time in their life, but everybody had to figure it out sometime or later. So shellfish is happening, nuts is happening. There's no drug, and this is not a plug for vaccines or anything, but if you've heard of somebody being allergic to the coronavirus vaccine, I will tell you this, they can't make anything on earth that somebody's not allergic to. I promise you, there's somebody out there allergic to it. Just free advice. So medications like antibiotics or penicillin. Penicillin is the most common anaphylactic reaction we have by far. Like it goes before bees and snake bites and food allergies, everything. Penicillin is the number one anaphylactic reaction we have. Also, allergies to non-steroidal anti-inflammatory drugs or NSAIDs. In the family of NSAIDs, you have things like aspirin, ibuprofen, naproxen, crap like that. All right, so what we're looking at here is a severe allergic reaction. So this is what's called erythema. Erythema is when the skin takes on a reddish tint to it. And this looks like he's got some hives here too. It's kind of hard to see if they're raised or not. But when the skin turns red, it's erythema. When it starts to raise up and become, like a raised hive look, when it becomes a raised bump looking thing, then it is actually hives. But this looks a lot like erythema. So erythema means just reddish skin. Erythrocyte, red blood cells. Erythema, red skin. So if medication is injected, the reaction may be immediate and pretty severe. Again, oral medications may take 30 minutes or more because it has to be digested. Other allergens are plants, dust, pollens, plant materials, ragweed, wiregrass, crap like that. Makeup, soap, latex is a particular health concern, so nitrile gloves are available. But again, everybody's allergic to something. You know, some people just don't have any common allergies, but you can't make anything that nobody's allergic to. These are facts. So insect bites and stings. This would probably be the second most common allergen that's out there. People are allergic to insects and the venom they put in there. Venom is designed to cause an allergic reaction, and it's designed to hurt you. It's designed to protect this animal, this bug or whatever, from a predator. And that insect bites and stings have been happening since ancient Egypt times. Since recorded history has been going on. I think it's called Hymenoptera sting. It's the study or process of insects and stings. It's going back a long time. Don't quote me on that. So envenomation is the process of an insect injecting its venom, and reaction can be localized or it may be severe and systemic. Localized means it's an allergic reaction. Systemic means it'll be anaphylaxis when it hits more than one body system. Hits a couple of them. I think it's 2 or 3. So approximately 2 million Americans are allergic to venom of bees, wasps, hornets. Allergic reactions to insect stings cause at least 62 deaths a year. So it's not a whole lot of people dying from it. It's probably because they're too far from medical care. I'm telling you, an EpiPen is a bad mofo. An EpiPen can go a long way, brother. I'm telling you, if you as an EMT have access to an EpiPen or the patient has one you can assist them with, you know what I'm saying? This is going to save their life. Those 62 deaths a year are probably people that live up in Blue Ridge, Georgia mountains or something. They ain't got access to healthcare really good. Or it could have been it happened so fast that we couldn't get anything into them. I'm not going to say that anything's outside the realm of possibilities, but I mean, that's not a whole lot of deaths for you. Now, there's a lot of reactions and anaphylactic reactions, but these patients are usually treated. But if it's not recognized and they ain't treated, they will die. Stinging organ of most insects is a small hollow spine projecting from the abdomen. Honeybees cannot withdraw their stinger. If they sting you, they're going to die too. But wasps and hornets, those are buttholes. They can sting you as many times as they want. So be aware of that. Some ants can strike repeatedly, and some people can be allergic to that. So signs and symptoms: sudden pain. If something just, ow, my neck, what was that? God dang. If something just suddenly hurts out of nowhere, I don't know, like something jumped up and bit me in the buttocks. All right, so if you got a sudden, or the patient has I don't know, I was just sitting here and I just felt a sudden pain here. Let me see. Oh, got a big old welt right there. So a wheal has formed. See, a wheal is WHEAL. It's a whitish, firm elevation of the skin that occurs after an insect sting or bite. So a wheal is that actually, it's the venom underneath the skin and it's slowly getting into the rest of the body. So sudden swelling, urticaria, redness on light-skinned individuals, itching, and a wheal. Severe anaphylaxis, the patient will have stridor, that upper airway constriction, bronchospasm, and wheezing. It ain't easy being wheezy. And that was cheesy. But hey, I could be a poet. Now you know it. So bronchospasm and wheezing, chest tightness and coughing, dyspnea, anxiety, gastrointestinal complaints, and hypotension. So the ones that are going to kill you are the stridor, the bronchospasm, wheezing, chestness and coughing, dyspnea, hypotension. Not that anxiety can't cause some issues for you, but this is what we're going to do for the patient, is we're going to actually have to treat this pretty aggressively. Patients may occasionally experience respiratory failure. If untreated, anaphylactic reaction can process rapidly to death. More than 2/3 of patients who die of anaphylaxis do so within the first 30 minutes. So if they die within the first 30 minutes, if you're going to die from it, it's going to happen in the first 30 minutes. If you, the EMT, and the national average of response is between 4 and 8 minutes. Average in the nation is a response time of 4 to 8 minutes. You've got time to do a full assessment, figure out what's going on, and getting those drugs in that patient's system, or getting ALS there to help out. So the patient needs epi. Now we practice. We practiced that EpiPen this week. We practiced the EpiPen. So what we're going to do is practice it again. Remember, remove the cap, remove the bottom, make sure it's the right way. Stab into the patient's thigh or the upper arm up here. You can assist them with the EpiPen. Stab into that leg and arm. Hold it for 10 seconds and allow that medicine to go into the body. That's step one. They're going to need some more drugs that ALS, your paramedic, can give. So if you are a BLS unit, make sure you're either A, called for a paramedic intercept, B, moving and grooving to a hospital. Hopefully you're close to one. Hopefully that patient has an EpiPen or so you can assist them. So you want to do a scene size up and assess the scene for scene safety. Remember, the scene size up is a way of gauging the scene, its specificities, and if you'll need additional resources. If you get there and you're a BLS unit, patients have a full-blown anaphylactic reaction, you're going to need a paramedic unit there, especially if there's no EpiPen in sight. Especially if there's no EpiPen in sight. Now, you'll have to forgive me because I'm not exactly sure what other states do as far as the EMTB scope of practice. But I think that some states have an EpiPen in there for EMTs to give to patients in an anaphylactic reaction if the patient don't have one. So we need to be finding one really quick. So as we're looking at the scene, we're going to, of course, check their airway, their breathing, their circulation. We're looking for life threats. Doing a full head-to-toe assessment. You're going to want to consider ALS really quickly. So quickly identify and treat potential life threats. Check and perform a general impression. It may present as a respiratory complaint or cardiovascular distress. It may not come out as an allergic reaction, guys. It may come out as just difficulty breathing. And yeah, it is a respiratory difficulty breathing secondary to an anaphylactic reaction. So we have to be very thorough to find out these things. So make sure you're calling for ALS and look for medical identification tags. Some patients wear necklaces, some have a little bracelet. These are the things we're talking about. So anaphylaxis will swell that upper airway and clamp it off. Remember, the trachea is one pipe, one tube. If that thing closes off, dead zone. You only have a few minutes to get that all done. So be quick, be efficient, but be thorough. So quickly assess for increased work of breathing. That means they're working harder to breathe. Use of accessory muscles. That means these muscles in the intercostals, the sternocleidomastoids, clavicular area. You're seeing all that stuff working. Head bobbing. They're working really hard to breathe. Tripod position is when they put a hand on each knee and they're leaning forward and they're trying to give their chest the most ability to expand. Nostril flaring and abnormal breath sounds. Of course, the wheezing. Put that patient in a high Fowler's. If the patient's in signs of shock and having hypoperfusion, put them in that shock position, flat, supine, feet elevated 6 inches. Don't hesitate to throw them on at high flow. In severe situations, if they're not breathing adequately enough, they're breathing too shallow, a BVM. Remember, there's a difference in oxygenation and ventilation. If the patient's bringing in enough air and putting out enough air, that's fine. We can do oxygenation. But if they're not breathing enough shallowly, we need to throw BVM on them. So the circulation may present with hypotension. That is when they're in shock. It is anaphylaxis until that blood pressure drops. Now they're in shock. May present with the hypotension, palpate for presence of rapid radial pulses, and their skin may feel cool, cyanitic, red, moist. They have delayed capillary refill. This will all indicate hypoperfusion. The patient's in shock. You need to treat for shock. Definitive treatment for anaphylactic shock is epinephrine. Either the patient needs to have some, you need to have some, or you need to have a way to get some to this scene, to that patient as quick as possible. Now, if you call and say, hey, I need a paramedic unit here. Closest one is 15 minutes. You've got a paramedic unit 15 minutes away, but you're 5 minutes from the hospital. Baby, that's load and go time. It's time to wrap, tap, tape it, and let's go. Grab the patient and go. You can be at the hospital with a doctor, all the drugs you can need. Now, the paramedic carries all types of drugs. He'll probably end up giving them 3, 4, 5 drugs and assisting that situation. That's great, lovely, wonderful. But 15 minutes versus 5, we don't know how long they've had this thing going on usually, and we need to get them to definitive care. That is a question for you to answer on scene. Transport decision, I'm not going to read that because guess what? I don't care. Get out of that scene, get them to an EpiPen or epinephrine as quickly as possible. Whatever that answer is, If that is for you to have a paramedic come and meet you and take over the call and start giving drugs, great. If it's faster for you to just run them to the hospital and it's okay with your SOPs and your management, great. Either way, err on the side of emergency transport. I'm not a big fan of any kind of staying and playing. Not a big fan of any kind of staying and playing. I like to load, go, and do everything en route. Hope that makes sense to you. So history taken, of course, we're going to come back to that sample history, OPQRST. What are the signs and symptoms we're getting? What are their allergies? This is the whole chapter about allergies right here. So you look like you're having an allergic reaction. What'd you do today? Well, I had an egg salad. Did you say you was allergic to eggs? Well, yeah, but I thought they cooked it out. No. We can't destroy all the enzymes that the egg produces that you could possibly be allergic to just by cooking them. So it's very important to take a history and find out all the who, the what, the when, the where, the why. Sample history, OPQRST on every patient. As much information as you can give the ER and the doctor there, the more they'll appreciate you, the more they'll think of you, and the more greatly you have done your job. So well, that's going to do it for this section here, guys. So just a quick recap. Allergic reaction can be a life-threatening emergency. Your job as the EMTB is to recognize that it's going on, do a thorough assessment, treat life threats, and get that patient some epinephrine as quickly as possible. If your service allows you, the EMTB, to give EpiPens and y'all carry one for this event, beautiful. Do it, baby. If the patient has an EpiPen, you can assist them with it by stabbing in the leg. It's actually kind of, I don't know, maybe I'm just a stabby person. Stab them in the leg, hold for 10 seconds, allow that medicine to go into the body. That will save their life. Now, there's other drugs to give during anaphylaxis, but none of them are really relevant to an EMTB at this time, so we're not going to spend the time on them, but Epi is what they need. Epi is what they need. Thorough assessment, find the allergic reaction, epinephrine. ALS units can give more other things, so whatever's best for that patient. Your job is to do patient advocacy. So if it's best for the patient to have a paramedic come to them right then and there, amen. If it's best for them to be just transported to the hospital, lickety split, amen. Do what is best for your patients. Any questions? I'm available this week. Send me emails, and we'll take care of it. Y'all have a wonderful week, and we'll see you at lab.